Title: Mental Health Fallout, Hospital Policies Ignoring the Needs of Patients, Mourning a Parent. Today, we're examining a critical but often overlooked aspect of healthcare: how hospital policies fail to address the mental health needs of patients who are mourning a parent. This article explores the silent grief that echoes through hospital corridors and the urgent need for systemic change to support those who experience such profound loss. Let's start by understanding the backdrop of this issue. Hospitals have traditionally focused on acute physical care, with mental health support, particularly bereavement care, often relegated to secondary importance. Historically, this meant that support came from clergy or external counselors, rather than being integrated into the hospital system itself. Although the hiring of social workers and mental health professionals has improved over the years, the systems designed to recognize and address grief remain patchy at best. Now, who are the key players in this scenario? We have hospital administrators, frontline healthcare providers, policymakers, and of course the patients and their families, especially those who suddenly find themselves without a parent. The relationships in these situations are complex and often underestimated, yet they are crucial to understanding the impact of what can only be described as institutional neglect. As we move forward, let's delve into some contemporary challenges. Despite a growing awareness of trauma-informed care, many hospitals are still lagging in implementing robust policies for grief support. Legal frameworks often just touch the surface, mandating only minimal psychological intervention, like handing out pamphlets or offering brief check-ins. This gap represents both a challenge and an opportunity for meaningful reform. Here's where it gets interesting. A 2021 policy review at 3 major hospitals in Maryland revealed a troubling trend. Most hospitals had a protocol for notifying next of kin after a death, but only one offered structured mental health outreach to patients who lost a parent while hospitalized. Most relied on ad hoc referrals to social work teams, who were often already overwhelmed and undertrained in trauma-specific grief counseling. Let's picture a hypothetical scenario. Imagine a woman named Lisa, recovering from surgery while her mother, just 2 floors below, succumbs to cancer. When Lisa learns of her mother's passing, she is handed a tissue and asked if she wants lunch. That moment of profound loss is met with a lack of support, leading to weeks of panic attacks and depression after her discharge. This highlights a critical point. The isolation and perceived indifference in such situations can have lasting effects. In reality, data from the National Institute for Healthcare Research shows that bereaved patients, particularly those mourning a parent, are 2.3 times more likely to experience anxiety and depression after hospitalization compared to those who didn't experience such a loss. Yet, structured interventions like scheduled counseling or peer group introductions occur in fewer than 15% of cases. Now let's add expert voices to this discussion. Dr. Miriam Johnson, a psychiatrist specializing in grief, points out that the systems are designed to push patients through, but grief disrupts everything. For someone losing a parent while in care, support is not just a nice-to-have, it's a lifeline. Studies link unresolved grief to longer recovery times and increased mental health risks, underscoring the urgent need for change. Next, we'll look at specific case studies that illustrate these challenges. Take the Martin family case, for example. Angela, an adult daughter undergoing chemotherapy, lost her father in the same hospital. She later developed symptoms of complicated grief, yet there was no structured follow-up or connection to mental health services. This is a recurring theme. Hospitals often have policies that sound good on paper, but lack the practical application needed to support grieving patients effectively. But not everyone agrees that formal grief support is necessary within hospitals. Some healthcare administrators argue that resources are limited and emotional needs can be better addressed outside the hospital. They suggest that grief is a natural process that shouldn't be medicalized. While these viewpoints have merit, evidence shows that hospital-based interventions can significantly reduce psychological distress and improve treatment adherence. Many patients don't have the social networks that policymakers assume they do, and post-discharge mental health referrals are notoriously poorly attended. Let's take a moment to acknowledge the voices of clinicians in this discussion. Social workers express frustration at existing protocols, noting that they see the fallout weeks later: panic attacks, medication non-adherence, and substance misuse. Some simple interventions at the bedside could make a meaningful difference. As we approach the implications of these findings, it's clear that inadequate support leads to immediate emotional suffering and long-term physical health issues. Families can fracture under the stress of unaddressed grief, creating ripple effects throughout communities and healthcare systems. But there's hope. Some hospital systems are beginning to pilot targeted interventions. For example, Boston General has implemented a model that includes real-time mental health check-ins for bereaved patients and peer support volunteers. Early results indicate a reduction in distress and higher rates of follow-up care. The American Hospital Association now suggests that bereavement-sensitive care should be part of trauma-informed practice. This means training staff in empathy and tailored support, and recognizing the critical window for early intervention. So what does all this mean? A parent's death is one of life's most profound transitions, and when it happens in a hospital, it amplifies the grief experienced by family members. Despite the clear evidence of need, many hospital policies still overlook the mental health of those left behind. Reflecting on our journey today, it's evident that resilience is possible, but only when loss is met with understanding, presence, and practical support. The challenge for hospital systems is to move beyond paperwork and platitudes, to truly see the whole patient in their pain and humanity. With the right structures and compassion, we can lessen the hidden fallout of hospital-based bereavement, allowing survivors not just to endure, but to ultimately persevere.